Good morning, everyone. Welcome to today's presentation of Veterans Benefits for Long-Term Care, hosted by Cassia. My name is Christine Drescher, and I will be your host today. Before we get started, I have a few housekeeping items. Please turn off your video and audio. Today's presentation will be recorded, and a link to view the video and handouts will be available within a week. I will email all that registered that information once it's posted on our website. CEUs will be available as well. I will have directions at the end of the presentation on how to receive them. We will be using the chat feature to ask questions throughout the presentation. If you have any questions, please put them in the chat and we will answer them during and at the end of the presentation. Now I would like to share just a little bit about Cassia, your host for today's event. Cassia is an affiliation of Augustana Care and Elam Care, who together have over 223 years of experience in serving seniors and their families. The word Cassia means the heart of a servant, and our mission is to foster fullness of life for older adults in the spirit of Christ's love. Currently, Cassia serves seniors in 5 states, mostly in Minnesota. However, we do have services in communities also in Colorado, Florida, Iowa, and North Dakota. Each year, Cassia touches the lives of over 23,000 people between our 43 senior housing communities, which include healthcare centers and our community-based services such as Grace Hospice, Open Circle Adult Day, Trinity Home Care, A&E Pharmacy, and more. Today's event is sponsored by a handful of our South Metro communities. I want to thank those communities for supporting our CEU series today and the ones we had earlier this year. So just some quick intros on those locations. Apple Valley Village has independent, assisted living, memory care, care suites, skilled nursing care, which includes both long and short-term care. They have market rate, limited elderly waiver, CADI, and HUD in their senior living, and in their skilled nursing, they take private pay, insurance, Medicare, and Medicaid. Currently, they have 1-bedroom apartments available in their senior living. For skilled nursing, both long-term and short-term, since that changes a lot, just give them a call for their current availability. Next is Emerald Crest Memory Care. Emerald Crest is dedicated to only memory care and is located in Burnsville, Minnetonka, Shakopee, and Victoria. They provide 24-hour supervision in 1-level homes with 24-hour nursing available on-site during the days, overnight, and weekends are on call. Emerald Crest has been providing memory care for over 23 years. They have a unique staged memory care where houses on each campus are dedicated to 3 distinct levels of dementia. Currently, Emerald Crest of Burnsville has 2 elderly waiver female shared units available. And at the Minnetonka, Shakopee, and Victoria locations, they have both private pay and elderly waiver available. Next is the Pines in Richfield. The Pines offers independent and assisted living along with care suites. They are in a beautiful area of Richfield that is close to shopping and also tucked in a park-like neighborhood. They offer market rate apartments and do accept some limited elderly waiver. And currently they do have 1- and 2-bedroom apartments open. Next is Praha Village in New Prague. Praha Village is one of our newer sites. They were built in 2019 and they offer independent, assisted, and memory care. They are a beautiful up-to-date campus in a growing area. And currently they are full but accepting individuals on their wait list. Next is the Regent of Burnsville. The Regent offers independent, assisted, memory care, and care suites. They are located on beautiful Early Lake and have access to those walking paths. The Regent is mostly market rate, but does have some limited elderly waiver and CADI. Currently, they have 1- and 2-bedroom apartments for independent and assisted living, and they have a couple care suite private units open, which tend to be very rare, so they'd appreciate any referrals to those care suites. The Rosemont offers independent assisted memory care and care suites. They are connected to the Steeple Center in Rosemont, which is the home of the Rosemont Area Arts Council and Senior Center. Currently, the Rosemount is market rate only, and they have just 2 memory care openings at this time. And lastly is our Open Circle Adult Day Services. Open Circle has been providing adult day services in the Metro for over 40 years. They have 3 locations, Apple Valley, Hopkins, and Minneapolis. Open Circle provides socialization, learning opportunities, stimulating conversation, activities, exercise programs, and entertainment. Payment sources accepted are private pay, elderly waiver, alternative care grant, CADDY, veterans benefits, and long-term care insurance. At this time, each location does have openings for new members. So thank you to all of our sponsors today. So at this time, I want to introduce our speaker, Mary Frances Price. Mary Frances is a shareholder of Moss and Barnett. Mary Frances has been licensed to practice law since 2005 and has counseled and advised hundreds of clients on their estate and elder care plans. Mary Frances focuses on practice on serving individuals and families who are establishing an estate plan, revising one, or dealing with the legal, medical, and financial impacts of aging, chronic illness, and disability. She has also been accredited to practice before the Department of Veterans Affairs since 2008. So at this point, we are going to pass on the slides to Mary Frances and get started. So please welcome our speaker, Mary Frances Price.
Good morning, everyone. Thank you, Christine, for that warm welcome and also for sponsoring today's event. I'm going to get my slides pulled up here for everyone. Okay, well, as Christine said, my name is Mary Frances Price. I'm a private practice attorney, VA accredited, which just means that I underwent some special training in 2008, and I have to maintain credits, probably like many of you, to maintain the licensure. And I've worked with a lot of veterans and their families across my years as an accredited attorney. And so today's presentation, very timely since we just had Veterans Day over the weekend. It's a good time for all of us to reflect and also learn something new about the populations we serve and how we might better be able to connect people to benefits that can help them access long-term care. So the benefits I'm going to focus on today, because I'm an elder law attorney, I tend to work with individuals over 55. There are other veterans benefits available to younger populations, but what we're going to talk about today will largely focus on, the over 55 population. So the first thing I always like to start with is just an overview of who should veterans and their families be working with to access information about veterans benefits. First, if you're in Minnesota, it's important to know that if you're a senior professional, anybody providing services that they charge for, even if you're advising on seeking veterans benefits, your engagement letter, by state law, we have a statute that requires any professional that is being paid for services to a veteran or their family has to disclose in their engagement letter or contract for services that information regarding veterans benefits is available for free through things like the Veteran Service Officer in the county or other veteran service organizations. So both the state of Minnesota and the federal government is concerned about predatory practices by some providers in terms of getting in front of veterans and their families. So they've cracked down on this in the last, I'd say, 10 years in terms of trying to develop laws and rules to put boundaries around who is legally authorized to counsel veterans and their families on how to access benefits. So this is a safe list. A family member can become an agent for purposes, a claimant representative is what the VA calls it. So a family member can become a claimant representative for an impaired veteran or a veteran that just needs support navigating a claim. You can work through accredited agents or accredited attorneys. Accredited agents are non-attorneys that have gone through the process of accreditation. Frankly, it's a lot harder to become a non-attorney agent. There aren't that many around in our state, but in other states there are more. And then we have accredited attorneys, of course. You can always safely advise families or veterans you're working with that they can go through a veteran service organization such as VFW or American Legion. They have accredited agents that would be appropriate to help educate and access information. And then, of course, we have our county veteran service officers. So some of the benefits we're talking about today are federal. They apply across state lines, but in most states, there is a county veteran service officer housed usually, alongside the Department of Human Services. But the idea here is that that is a resource available to residents of a county to access information about veterans benefits, and it's free. And it's safe. So this is the list of kind of safe contacts. If you're working with someone who's trying to find good information about veterans benefits, you want to be cautious about places that hold themselves out as, oh, we can help you process a claim for free, because they're usually trying to sell some sort of financial product, maybe insurance or annuity. The VA is very concerned about predatory practices with certain organizations. So you just want to be cautious if you're making advice or trying to connect a family with resources. So I alluded to this a little earlier. There are two main funding sources for veterans benefits. We have a Department of Veterans Affairs at the federal level, second largest federal agency. And then we also in Minnesota have the Minnesota Department of Veterans Affairs. Each state also has their state-run Veterans Affairs. We're going to talk specifically today about Minnesota and some federal benefits. If you're in another state, you'll want to be mindful of your state veterans benefits, but today's presentation will focus on Minnesota. When you're working with families, a good place to start if they are unsure whether or not they have a service record that will entitle them to certain benefits, I always ask my families if they have access to their discharge record or certification of military service. The most common form that we see is something called a DD-214. DD-214 is a one type of certification of military service. Some people don't have that. They have something equivalent. The archives.gov is a place that families can go to reorder military service records. It's a website you can order directly online, or you can print off an application and send that in via fax or mail. But the most efficient is their online submission to request certified copies of discharge records. I always mention that, the archives are in St. Louis. There was a major fire that impacted certain populations. That fire was in 1973. So we are still working with populations who may have been impacted by this. It's just something to keep in mind that if you have somebody who's told by the archives that, their record is damaged or destroyed, that there may be an alternate means to recreate their military service record. So that's just something to be mindful of. But the main takeaway is, in order to be able to access any benefits, you have to start with some sort of proof of military service. If it's a spouse or child seeking benefits, in addition to the record of military service, you also have to have the marriage certificate for spousal benefits, and of course, birth certificate if you're seeking dependent benefits. So 2 additional documents that may be required depending on who is seeking the benefits and what benefits they're seeking. I always like to provide the service date ranges. We're going to talk specifically about different programs today. One in particular as a requirement that service dates would have included at least 1 day of active duty service that fell within a wartime or conflict period. And here are the main ones that we're dealing with at this point. Fewer and fewer World War II veterans, Korea and Vietnam primarily, but some people, for example, are surprised to learn the Korean conflict date actually, spanned longer than maybe they had realized. And as we'll discuss, for the non-service connected pension, which is commonly referred to as aid and attendance, active military service, at least 1 day that fell during these periods would be required to access certain benefits. So I'm going to show you a copy of a DD 214 here. By the way, this is from the public domain. This is not, somebody I know personally. I literally Googled DD 214. This was available on Google. So this is an example of a military service record. But what I really want to show you is, if you could see my mouse hovering over here, total active service. So when I read this record, this particular veteran had 1 year, 11 months, and 12 days of total active service. That would be essential. And then also up here, you can see the actual date range. Date of entry, March 5th, 1960. Date of discharge, date of entry. Date inducted, March 24th, 58. Date of discharge, March 5th, 1960. So what I can tell from that is this is what is commonly referred to as a gap guy. It's somebody who fell between Korea and Vietnam. And so they have active duty dates that would entitle them to certain benefits, but this is not somebody who would be eligible for the non-service connected pension based on the service date range. So this is an example of a discharge record. So if you're ever looking at one with a family you're serving, those are kind of the critical pieces of information you're looking at to assess what's your total active duty service and when did the service occur? Do we have any wartime or conflict period service? And let's see, do I want to say anything else about that? I don't think so. So I'm going to move on. I often get a question about the effect of divorce, death, or remarriage. If somebody could have been married to a veteran for 40 years, if they divorced, that automatically severs any ability to claim spousal benefits. Okay, sometimes because the Social Security Administration offers a benefit even to former spouses, people mistakenly believe that extends to veterans benefits. It does not. You have to have been married to the veteran on the date of the veteran's death in order to be eligible for surviving spouse benefits. And so you may be able to make a claim on the veteran's record if they've predeceased, but not if you have remarried. If you've remarried, then you can go in on the current spouse's benefits if he or she is a veteran. If that second or third marriage ends by death or divorce, then they can go back and seek benefits on the first spouse's record or any previous spouse that the person was married to and was married to the veteran at the time of death. So, I've actually had that apply where I've had people married a second time. Their first spouse died of Agent Orange exposure related illness. And then once the second marriage ends because of death, they're able to make a claim on the previous spouse's record. So that's just something to keep in mind. So I'm just going to pause there. Christine, do we have any questions at this point?
Not right now.
Okay, all right. Hearing none, we'll just transition then. I'm going to move into an overview of some Minnesota state veterans benefits. I just put a reference in here to the Minnesota rules, chapter 9050. This is the chapter that governs access to Minnesota veterans homes. It's something to keep in mind if you're helping a family or if they want to actually read the law, like what are the admission criteria. I've spent a lot of time since 2008 getting acquainted with this chapter, but that's where you access actual legal information about the rules governing eligibility for veterans benefits in Minnesota. Some of the benefits to be aware of for families we serve, of course, would be access to the Minnesota veterans homes, adult day services, suicide and homelessness prevention, health and disability assistance, dental, education, and employment. I've got a reference here to the Minnesota Department of Veterans Affairs website if you want to look at additional information. In my practice, I spend a lot of time counseling people on how to access the first two on this list, which would include the Minnesota Veterans Homes and adult day services. So in terms, and I want to point out that adult day services, there is an adult day center on the campus at, for example, the Twin Cities Veterans Home, the Minneapolis Veterans Home has a facility on its campus, but other veterans may be enrolled in the federal VA healthcare system and entitled to reimbursement in community-based facilities like Open Circle. So that's not a Minnesota state benefit, but a veteran who is enrolled in the VA health system may be entitled to reimbursement at a community provider, Open Circle being an example of that. But in terms of the veterans' homes in Minnesota, we have 4 currently open locations: Fergus Falls, Silver Bay, Laverne, and the Twin Cities. These are skilled nursing and memory care communities. We are anticipating new facilities opening in Bemidji, Montevideo, and Preston. They were supposed to have opened in June. Recent updates say they hope to have them opened by the end of the year. They're in the process of finishing and staffing, is what I'm understanding. There is a wait list for the new locations as well as the currently open locations, but they are taking names for the future sites that are not yet opened. Sometimes people ask about the facility in Hastings. There is a Minnesota Veterans Home in Hastings. This is a board and care facility. It is not a skilled nursing or memory care community, although there may be people with some level of cognitive impairment living there. The populations I've worked with and seen in Hastings would tend to be younger veterans that are higher functioning in terms of ADLs. They may be transitioning from homelessness or addiction, dealing with substance abuse issues. That's not exclusively who you see there, but those are some of the examples of people I've served that had the opportunity to live in Hastings. But if we're talking about our over 65s skilled nursing care and memory care, then we're looking at the other locations. And Hastings, some people are just not, it's not high support enough for certain patients. So in order to be eligible for Minnesota Veterans Home admission, the veteran had to have served at least 181 consecutive active duty days or more. They have to be over age 55, and this extends to spouses too. So the person seeking admission has to be over age 55. They need to be in need of skilled care. I've actually had people denied admission because they're too healthy, they're too high functioning. I had somebody who was really, using a walker, got some assistance with bathing, was living in assisted living, but was high functioning in terms of cognition. And he was denied admission on the basis that, his clinical need was not at the level of the care that was provided at the vet's home. I've also had people denied admission because they're too aggressive. And I've had people denied admission because, their record would suggest they're going to be what I call too annoying, but it's more like they can't really, an example would be I had a client who disabled locks. And so at least at that time, the facility was not in a position to be able to have a one-on-one follow him. And he was, fixated with doors and locks. And so that was a situation where admission was denied on the basis of just, we can't really support that. So they do have the opportunity to assess, as any facility would, and make a determination as to whether or not the needs of the prospective resident can be met. This benefit is open, as I said, to the veteran or their spouse. And so if a veteran's living in the community and the spouse is the one that needs care, the spouse could go on the wait list. The VA currently maintains 2 lists. One is an inactive. I like to think of it as a pool of prospective residents. Some people who are in the spirit of planning will get their DD 214. They'll marriage certificate if applicable, and they'll file their papers and ask to be put on the inactive list. The active list, in contrast, is being actively managed. And this is the one where, when you float to the top, depending on the wait list, typically people are contacted, I'd say 6 to 8 weeks out before an anticipated opening, and to begin kind of the paperwork. When people are not ready to move, they can say no once, go back to the bottom of the list, float back to the top. If you say no twice, then you have to go off the list for at least 12 calendar months before you can go back on the active list. So timing can be essential. Sometimes I'm working with families where somebody's going to be, they were in a Medicare qualified stay in rehab. The Medicare coverage is going to end. They're looking for active placement. The veterans home is not the place where you could call and say, hey, can you take my dad next Thursday? It would be a longer range plan. And so sometimes people will transition someone to a community-based facility, putting the name on the active wait list, and then making a decision later about whether or not to transition the veteran or the spouse at that time. So the wait list for male veterans tends to be the shortest because there are more beds available for men. Female veterans take priority over non-veteran spouses. And so I've had spouses, non-veteran spouses on the wait list for as long as 36 months. So it's something that would require planning to address what would happen if a need was, if you had a need before that person came up on the wait list. So let's take a look at some more specific information in terms of when you compare the Minnesota Veterans Home rules to Medicaid. They're very favorable, and that's number one is a spouse can have unlimited assets. For Medicaid, currently a community spouse, the spouse living at home, is limited to $148,620 of available assets, a house with equity up to $688,000, one vehicle, personal property, and a prepaid funeral or burial plan. Here, there is no limit on the amount of assets that a spouse can have, as long as the assets are in the community spouse's name before the veteran spouse or the resident spouse moves into the veteran's home. And there's no look back on transfers between spouses. So that just has to happen up to the day before the person moves in. The resident can decide whether or not they want to make income available to their spouse. So let's say you have the spouse going in for care has higher income, and the spouse living at home is worried about how am I going to make ends meet. The resident spouse is allowed to allocate income to the spouse at home. But if that spouse elects to receive income, then they absolutely can do no gifting, because the presumption is you need that money for your own self-support, so you can't turn around and give it away. If the spouse does receive income, then the spouse is going to have some limitations on how they can use their other savings and investments. So the decision of whether or not to receive spousal income is something that should be considered carefully by each family, depending on their circumstances before admission. I'm going to share with you just a couple of examples. Here we have a veteran who needs skilled care. He and his spouse co-own an apartment building worth almost $1 million that produces $50,000 a year of income. The veteran moves the title of the apartment building into his name alone, and his spouse moves to the Minnesota Veterans Home. There's no penalty for this transfer. All of the income, that $50,000, would be allocated to the spouse at home, in this case, the veteran. And then that spouse's monthly maintenance charge would be based on her fixed income. In my example is just Social Security alone. So, this, I think, hopefully illustrates, like, there is no asset cap in Medicaid. In Medicaid, that would look very different, right? That spouse would not be allowed to keep that apartment building. It would have to be spent down, or they'd have to find other ways to pay for market rate care at the veterans, or I'm sorry, in Medicaid, they'd have to do a spend down. So another example, veteran needs skilled care. Veteran has a $350,000 IRA. That's an individual retirement account. The spouse has minimal retirement savings. Because the veteran is the one who needs care, and the veteran has this tax deferred retirement account. Remember, IRAs have, they are fully taxable. So somebody might say, well, why don't you just cash it in and transfer it all to your spouse? Well, because you're going to lose about 40% of the value because you're going to have to pay income taxes. And if you cash out a $350,000 IRA, not only are you going to take a tax hit, but then in 2 calendar years, your Medicare premium is going to go up because in 2023, it looks like you had an additional 350,000 of annual income hit your taxes, which means your Medicare premium is going to go up in probably tax year 2025. So here, because the IRA is tax deferred, you would want to hit the pause button and say, okay, what's the life expectancy of this veteran? What are the tax consequences for cashing in the IRA? Let's calculate a break-even point. Sometimes people lose sight of the fact that we have tax issues, which may make this arrangement, they're thinking, oh, the vet's home is such a good option. But here, actually, private pay in a community-based facility, utilizing that IRA and offsetting, itemizing medical expenses to offset income might be a better short range solution here. So I always like to point this out because sometimes people lose sight of the big picture and they don't fully understand the tax planning pieces associated with making a decision. They just get excited about the potential of the veteran's home. This is a similar example, okay? Almost, it's actually identical. The only difference is instead of that 350,000 being in an IRA, it's in a 401k. That is actually hugely significant because a 401k is governed under federal law called ERISA. And what this means is the spouse could transfer a 401k to the at-home spouse without triggering taxes, okay? So depending on the type of retirement plan, we may be able to transfer it over to the spouse at home without having to take that tax hit. And so I just put this here as an illustration of a situation where this family would want to get further legal and financial counseling before making a decision, but there may be this advantageous opportunity to protect that retirement account and get it to the spouse at home. So here with the veterans home, the thing to keep in mind, asset repositioning would be key, a key factor in realizing the spousal benefit. Current veterans home rules allow for transfers between spouses. But when a spouse does this, obviously they're going to have to update their estate plan. So if you take my first example with the veteran who was holding the apartment building, he needs to probably update his estate plan because if he has a really old will, what it says is everything to my spouse if my spouse survives. If he dies owning that apartment building, everything would go to the veteran's home spouse, in which case she would be expected to private pay and draw down until she's at or below $3,000. So again, if the ill spouse moves to the veteran's home and the well spouse should update their estate plan. Okay, typically they're going to be looking at what we call a spousal omission plan. That's a decision that would be made with the community spouse's attorney. So I like to talk about a little bit about estate recovery. This is a Medicaid concept. So, in Medicaid, when somebody receives medical assistance, whether it's MA for long-term care in a nursing home or MAEW in a community-based setting, the state of Minnesota is keeping a tally of all of the dollars that have been provided to that Medicaid recipient. And at death, they can attach a lien or an estate recovery action against the estate of the predeceased or the spouse. Okay. So, somebody goes on Medicaid, is in memory care, and they die. Let's say they received $100,000 of medical assistance. When their surviving spouse dies, the state of Minnesota is going to be trying to seek recovery of that $100,000 plus interest. Currently, under the Vets Home rules, there is no estate recovery. Okay. In recent years, we believe that the Vets Home is moving toward an estate recovery model, but the rules have not changed to date. There is no estate recovery. When somebody goes to the veterans home, they could receive, tens of thousands of dollars of care. And under current law, there is not an estate recovery action where the state is going to try to recover for expenses provided at a Minnesota veterans home. I touched on this a little bit earlier, the adult day programming, but Minnesota Department of Veterans Affairs does run an adult day campus, a program on the campus. And as I said, the federal VA also offers support for adult day programming that might be at community-based providers. So it's just, there's two different options for families seeking day activity programming, financial support. So I'm going to pause there and before we transition to some other benefits and just check in with Christine to see if we have any questions.
You know, we do have one real simple question. Did the St. Cloud Veterans Home close?
So St. Cloud does not have a Minnesota veterans home. It has a federal VA nursing home. That's a good question. That is not a Minnesota Department of Veterans Affairs facility. That is a federal VA nursing home and hospital and clinics. It's still open. Typically, admission to that nursing home is going to be limited to veterans that have a service-connected rating of 70% or higher or meet other disability criteria. So that is not governed under the same rules that the Minnesota veterans homes are, because that's a federal facility and only certain populations have access to the skilled nursing facility in St. Cloud. But the hospital and clinics, we're going to talk about who can see providers there, but the nursing home has limited admission based on the service record and the disability rating of the veteran.
Great, that's all for now.
Okay, so let's talk now. I'm going to, so we just spent time talking about some of the more common Minnesota state veterans benefits. Now I'm going to transition into federal VA benefits. So this would apply for veterans living in any state. So the way the federal VA breaks down is there's two main branches for services. The first is the VHA, the Veterans Health Administration. The second is the VBA, the Veterans Benefits Administration. In order to seek admission to the Veterans Health Administration, this would include the St. Cloud Hospital and the Minnesota Hospital and clinics throughout the state. Admission is granted to anyone who served at least one day and was discharged other than dishonorably. And somebody seeking admission, the veteran would complete Form 10-10EZ and submit that with their service record. This is a benefit that is limited to the veteran. There is no access for spouses, you know, at the VA medical centers, the federal VA medical centers, okay? So again, looking more closely at the VHA, what we're talking about would include the VA hospitals and clinics and nursing homes. As we said, there's one in Minnesota, only one federal nursing home. That would be the St. Cloud Nursing Home. Having said that, veterans who are service connected at 70% or higher can get their care provided at other community partners that have a contract for reimbursement through the VA. So St. Cloud is the only federal VA nursing home in Minnesota, but there are many private nursing homes that have a contract to provide services and will be reimbursed through the VA for certain veterans. Prescription drug benefits, outpatient dental, blind, hearing impaired, and then of course, home and community-based supports. This is an area that has really expanded in the last decade in terms of addressing or attempting to address the needs of aging veterans in the community. So people living in private homes or assisted living may have access to some veterans benefits that would fall under the home and community-based supports. I'm working with actually a family, it's a coworker of mine here at the law firm whose parent is up in Bemidji, a veteran, and she is seeking, you know, home and community-based supports that would be reimbursed through the VA, including things like home care and nurse home visits for her aging veteran who lives outside of Bemidji, as an example. So Veterans Benefit Administration, remember that's the other side. There's VHA, VBA. VBA is the side that provides things like service-connected compensation. We're going to talk about what is that. But basically it's monthly compensation for veterans who were disabled as a result of their service or had a condition that was exacerbated by service. VBA also includes things like home loans, burial benefits, life insurance, and also the non-service connected pension, which is commonly referred to as aid in attendance. So I've mentioned this term a few times, service connected. Service connection is when a veteran applies to become a patient in the VA medical system. They can ask to be evaluated for a compensation and pension physical evaluation. If the veteran is found to have a medical condition that was caused or exacerbated by military service, they can be rated for a recognized disabling condition. Ratings are in 10% increments. There is a 0% rating. I've seen it a couple of times where somebody might be rated at 0%. That means you have a disability, but it hasn't risen to the level where it's impeding your ability to function. If it hits 10% and above, then the veteran starts getting monthly tax-free compensation. Once it hits 70% or above, then that veteran will have long-term care and all medical covered through the end of life, so long as the veteran elects to receive the care at a VA facility or a VA contracted facility. Ratings can go up and down over time. Some ratings are permanent and some are fluid. So for example, I've had veterans who are rated at 100% for prostate cancer due to Agent Orange, and then they are treated for their cancer and there's no evidence of disease. And so then they lose their rating and it goes down, and then they lose their compensation. And then, of course, there's total and permanent disability ratings, and those don't go up, and they may go up, but they don't go down. Veterans can have more than one rating. An example would be 10% rating for hearing loss and 60% for heart disease due to Agent Orange exposure. So it's important if you're working with veterans to know, are you service connected? Because that will move up their priority enrollment group within the VA healthcare system. And of course, they're entitled to more compensation. And in the case of veterans who are 70% or higher, it's going to unlock significant benefits within the federal VA system, but also at the state of Minnesota. When you are working with someone who is disabled at 70% or higher, if they own real estate, they're eligible for property tax relief. So you'd want to get them connected with the county of their residence to take advantage of property tax relief for any veteran who's service connected at that level or higher. Let's see. So I've talked about this non-service connected pension a couple of times. This is the one that I think a lot of people call aid in attendance. Aid in attendance, you'll learn today, is really a medical rating, but it's a term that's been linked with the non-service connected pension. But the actual correct term, if you're talking to VA people or trying to access the benefit, is the non-service connected pension. This is the one that requires the veteran to have at least 90 consecutive active duty days, 1 day during the wartime or conflict period, and the other than dishonorable discharge. So this is the one where you'd have to look at those service date ranges and see, did it fall within World War II, Korea, Vietnam? Doesn't matter where they were or what they were doing. The only question is, were you on active duty at least 1 day during those time ranges? And if you were, then the veteran has a service record where further evaluation for the benefit can be undertaken. So there's actually two types of non-service connected pension. One is called improved disability. That's when the veteran is living. If the veteran is not living and there's a surviving spouse, it's called improved death pension. It never ceases to amaze me how boring these titles are through the VA, but in fact, so the surviving, if there's a situation where there is a healthy veteran with an ill spouse, they cannot make a claim for the pension on the basis of the spouse, but if the veteran dies, then the spouse can make an independent claim. Now, let's say the veteran has some of, his or her own assisted living needs, but the spouse is way needier. As long as they have any need of their own, the veteran could make a claim, and then they can bring in all their spouse's expenses too. But if the veteran is totally high functioning and healthy, they can't make a claim just on their spouse. But if they die, then the spouse can claim. So it's kind of unfortunate, but that actually matters when you're thinking about this benefit. Eligibility is determined based on two factors: clinical need and financial need. So that's not that surprising. It's like medical assistance or Medicaid. We're going to dive into more of the financial, but we'll also take a look at clinical. The VA looks at income and assets just like a Medicaid analysis would. Within the VA, they use income for VA purposes, or IVAP. So when you're looking at eligibility for this program, you have to take the gross income, that's top line. It's not what's deposited in the bank, it's the top line income before any deductions. So you take that gross income and subtract all unreimbursed medical expenses to determine what, if any, award the claimant is eligible for. Unreimbursed medical expenses can include what's on this list. I underlined institutional care and in-home care because those are typically some of our higher cost. It's important to note that rent in assisted living or assisted living with dementia care is considered an unreimbursed medical expense, both for purposes of VA benefits, but also for claiming a deduction on income taxes. So rent is an itemized deductible expense for both federal purposes, whether you're trying to file an income tax return with the IRS or for VA purposes. And so, that rent can be significant. And so that's why I like to underline and highlight that. So clinical need, this is where you see that term aid in attendance. It's a medical rating. The claimant has to be rated for what's called housebound or aid in attendance. There's a form that has to be completed by any doctor who's examined the claimant. It can be somebody from Bluestone Medical Group or Allina Clinic. It doesn't have to be a VA doctor. This form can be completed by a doctor that has examined the person seeking the claim. I've included in here what the definition of housebound is, just for your own understanding. Housebound is a lesser rating than aid in attendance. Since I think most of you are probably familiar with aid in attendance, I'll fast forward and we can take a look at what the definition for aid in attendance is. This is somebody who's has an inability to dress or undress him or herself, to keep himself clean and presentable, adjustment of any specific prosthetic, feeding. So again, this is the ADL list, right? This is just the VA's way of expressing the ADL standard or the cognitive standard: incapacity, physical or mental, which requires care assistance on a regular basis to protect the claimant. So aid in attendance is the highest level of medical rating for this program. And I think that's why most people, like 10, 15 years ago, when we really started talking about this, started to associate this program with aid in attendance, because people would hope to get the highest medical rating because that's where you get your biggest financial benefit. So in terms of financial benefit, again, there's a specific formula we use to determine whether or not the person seeking reimbursement gets the maximum award. I'll show you the current rate table. Okay, the current rate table for surviving spouse in 2023. You can see the maximum award is about $1,244. The married veteran, married veteran, $2,642 per month of additional tax-free income. This number goes up every December 1st. So in a few weeks, these numbers will increase, but this is the rate table we've been using in 2023. So I want to show you how these rate tables work with a specific example. So here, let's take a look. If I have a married veteran living in an assisted living facility and the gross household income, remember gross before any deductions, is $3,000 per month. We have deductible medical expenses. And again, this is rent, this is services, this is premiums for Medicare supplement, this is out-of-pocket co-pays. We're averaging $5,700 per month. So we're going to take that total income and subtract all of the medical expenses to get our reportable income for the VA. So here we're in the negative, right? 3,000 is all we get. We don't have enough income to pay. So my reported income for VA purposes is $0. You can't go negative. The lowest you can go is $0. Okay. And so here, and again, the maximum, this person would be entitled to the maximum award for a married veteran, is what I'm trying to illustrate here. Okay. So that's how the income analysis works. Okay. We have to also look at the assets. And right now, the Brightline asset limit for this non-service connected pension known as aid and attendance, the Brightline asset limit is $150,538 total for the married veteran, or for the single veteran, or for the surviving spouse. It's the same threshold for all. And then I talk a little bit about how that net worth is computed. One thing I'll say is that the vets, this 155.38 does not include a homestead, even if the veteran is single and not living in the home. They can have a home place that is excluded, even if they're living in assisted living, for example, and they have a house in the community and they're renting it, or a family member's living there, they get an exemption. That's very different than medical assistance, where if you have a house and you're in assisted living and you're seeking assistance, you're going to be expected to sell that house. The vets rules are a little different when it comes to the homestead. So the exempt or exception to countable assets, the home plus 2 adjacent acres. But if somebody has a home and then a 100-acre farm, the 98 acres that aren't adjacent to the home are going to be considered an available asset. They will not be exempt. Personal effects are exempt. Again, the claimant doesn't have to live in the home. But if somebody, let's say they seek the pension, they get the pension, they're in assisted living, and then their house sells, well, then they're going to have to report that to the VA, and their benefit will be terminated if they go over 150,000 in assets as a result of that home sale. If they don't, if they're still under the 150 asset limit, even when the house sells, then it's fine. I will say that in recent years, there was a major change to this non-service connected pension program in 2018, imposition of a 3-year look back, these really stringent asset limits. And so the number of Minnesotans seeking this program has dropped substantially since 2018 because of these new rules governing eligibility, most notably the imposition of a 3-year look back on gifting before qualifying. Okay. So I've got an example here of how we have to look at the income and the assets combined. And I'm not going to go through every single one of these examples, but they're in the materials if you want to take a look at them. Basically, you have to factor in the way the VA counts net worth. It includes the annual income. So very different than medical assistance. The level of detail I've got in these slides here is probably beyond the scope of what you may need to know. I think the big takeaway should be, if you have a family who's trying to access the non-service connected pension, they should definitely work with an accredited agent, attorney, or veteran service officer, or somebody that can help them evaluate, hey, am I really eligible for this? Because it's pretty complicated. Okay, so let me see, do I wanna, these are just some of the 2018 changes. I did want to point out that a sixth ADL was added, which is difficulty getting around inside somebody's house. So that basically opened up the opportunity for more people to qualify. Also, expenses for assistance with not just ADLs, but IADLs by an in-home attendant are also includable medical expenses. Prior to 2018, they would not have been. And the healthcare provider, is the one certifying the medical need. And it used to just be a physician, but now it could be a physician, a PA, and or a nurse. So they expanded the definition of healthcare provider for purposes of certifying the clinical need. And then this opening up of the IADL support also allowed for more expenses to be brought in. And you can also pay a family member, but you have to have a personal services agreement. You have to be paying them at regular intervals within 60 days. And they have to be claiming the income and reporting it. Because this is a federal agency, they do skip trace social security numbers to make sure that if somebody is identified as a provider and they're being paid for services, federal agencies are going to want to make sure that that person is reporting the income to the extent they have a legal obligation to do so, and make sure that they're paying income taxes. So families that are like, well, can't I just like pay my son or daughter cash? Sure, you can pay cash, but they have to report that as income. And then it opens up all these other questions about what additional documentation would be needed. So I do have families that pay family members for services, but they want to be sure to do that properly. I mentioned the imposition of a 36-month look-back period for this program. This applies to gifts or transfers that happened on or after October 18th, 2018. So only assets that are considered covered assets will trigger a penalty. I've got a couple of examples we'll take a look at. But basically, the maximum penalty would be 5 years. And there's a way the VA calculates penalties for gifting differently than Medicaid. So here's an example. If somebody gave their son $50,000 for a divorce lawyer in 2019, claimant applies for the pension and at the time of application has a net worth of 126. And is the claimant financially eligible? The answer is yes, because the gift was more than 3 years before the application. So because it's outside of the 3-year look back, we don't have to worry about that particular gift. And also the claimant is under the threshold of 150,538, only having 126,000 for net worth. So that gift was more than 3 years, it's disregarded. So same exact example, except that the gift was given in November of 2021. Clearly that would fall within the 3-year look back period. At the time the claimant applies, his net worth is 75,000. Is the claimant financially eligible? Yes, because even though he made a gift within the 3 years, if you add it back, he only has 125,000, which is less than the 150. So therefore, the gift, even though it's in the look back, isn't going to cause a penalty for this particular claimant. So again, these are very fact intensive. And that's why I think the right answer for most professionals that are working with families that are trying to figure out whether or not non-service connected pension is an option, for a couple of reasons. Number one, it's complicated to do the analysis. Number two, Minnesota state law requires that not even an accredited attorney can charge for doing this type of analysis. We are allowed, there are very strict limits on when you can charge a veteran or their family for any provision of any services. So that's another thing to be mindful of. If you are a professional who is paid and you're working with veterans, you want to make sure you're not running afoul of our state law that requires you to provide free resources and also make sure that you're in compliance with the rules governing when you can bill for services. Okay, so I just wanted to look at another example. So here, claimant gives the son $60,000 for the divorce lawyer. Oh, let's see. Again, I think this one has got a typo in it because I was trying to show that if the gift put them over the threshold, then the claimant would not be financially eligible. So, so sorry, my numbers are off on this slide because I should have updated that 60,000 to 80. And then the point here is that if you make a gift, it falls within the look back, and then you add the gift back in. If it puts you over the threshold, then that's going to cause a period of ineligibility. And the reason you'd want to compute the period of ineligibility before telling somebody to go apply is once a period of ineligibility is set, it is locked in and you cannot unravel it. So you don't want people who've done gifts to go make an application and lock themselves in to a penalty period that might be longer than just waiting for the 36-month look back period to expire. Okay, so annuities and trusts, I just want to mention here that prior to that rule change in 2018, it was common practice by attorneys and insurance professionals to use single premium immediate annuities. That's what SPIA stands for, single premium immediate annuity, and or specialized trusts that would allow veterans to transfer property without penalty. And one of the major changes in 2018 was the VA cracking down on these practices utilizing annuities and trusts. And so when people have trusts and or annuities and they're trying to seek veterans benefits, I just wanted to highlight that this is a special circumstance where further support would be needed to make sure that the veteran and or the family understands how a trust and or an annuity would be treated when they're applying for these benefits. So just kind of to summarize, the non-service connected pension, commonly referred to as aid and attendance, like Medicaid, has a clinical assessment and also a financial assessment that's required. The clinical assessment is the easier of the two. It's usually a medical provider completing a form. And then it's really the financial assessment where there's a level of complication potentially, although I'll say sometimes I meet people where it's just a slam dunk. They just need to go apply and they would be eligible and could begin receiving the services. Since the law change in 2018, the population that I've seen that benefits from non-service connected pension would be a veteran or a surviving spouse that has some sort of pension, like a public employee pension, a teacher pension. So their base income is higher than average. And they may have some minimal assets, but they are in assisted living or assisted living with dementia care. And another, let's say $2,000 or $3,000 a month could help them extend their ability to private pay. But they have a solid base of income that's higher than average because they have a pension, maybe a pension and Social Security. But with the imposition of the look back and some of these other changes, I've seen fewer families actually benefiting from this program. But the families that I see usually have that some sort of pension plus Social Security. So their base of income is a little higher. And then the pension program can just help them bridge that gap and maintain private pay longer so that they don't have to go on medical assistance, or they can stretch out the use of their private resources longer, trying to avoid going on Medicaid and having an estate recovery lien against their spouse's estate at death. So with that, I will shift into any questions that may have come in since I've been chatting away. Christine, do we have any new questions?
We do. Excuse me. So Greg would like to know, are there service dates for Desert Storm?
Right now, believe it or not, they have Congress has not set an end date to Desert Storm or Afghanistan. So it's open-ended at this point, and it would take an act of Congress to set the date ranges and, you know, a little lawyer humor. I don't see Congress getting anything done. So at this point, there is not a date range set for that population.
Okay, thank you. All right, we had a question, but it sounds like you answered it after she put it in the chat. So at this time, I don't have any others, but we'll give it a minute or so and see if any others come up.
Okay.
I'm going to go ahead and switch back to my slides. And just go over again, as we wait for any potential other questions to come through, I just want to share that if you need a CEU after this presentation, I'm going to have you go to this online survey. It only takes about a couple minutes. I did put the link in the chat room, so you can easily copy and paste it. I'll also send it in an email too. But I just have a couple of questions just to kind of help us plan for future presentations in 2024, and then to receive your information for that CEU. So just a should only be a couple minute survey there. Let's look at, oops. Still nothing in the chat room. All right. Well, thank you, Mary Frances. I think you must have covered everything. So thank you so much for all that great information. For those that are on, I will be sending out an email. Oh, I do have a question. All right. Are there any benefits available for disabled children of the vet?
Yes, potentially. The child has to have a disability that's recognized by the VA. So it's not the same standard as a Medicaid or a child that's has a recognized disability for the Social Security Administration. So they look at things like the age of onset of the disability, dependency status on the veteran. It may include burial benefits. There are some financial benefits, and when there's a child that has a recognized disability through the VA and the spouse or the veteran has like a Department of Defense pension, they can assign that pension to a supplemental needs trust for the benefit of the disabled child even after their death. But that has to be set up prior to the death of the veteran, and that's for career veterans that have DOD like pensions, Department of Defense pensions, which means they've served at least 20 years career and or National Guard. And so there are benefits for disabled dependent children. It has to be a child that's recognized as a disabled dependent before the VA. So I think just generally, yes, possibly, and that family would want to get some guidance, could start with the veteran service officer and or accredited agent or attorney just to assess their individual situation.
Great, thank you.
Mhm.
Okay, we'll move on. I don't have any other questions here. Thank you again, Mary Frances. I'm hoping we can get you back for maybe some other topics in 2024. For those on here, like I said, if you complete that survey, we'll get you the CEU. I'll also be sending via email, not only that survey link, but also when we have it, a link to the video of this. If you want to go back and revisit it, we'll have it available online for a couple months, and then also handouts. So we'll have those available too. So that should take a week or so to get that all set up here. So, all right, Greg, I am going to have Mary Frances send you a message about your last question here, because I think we're going to wrap up right now. And thank you all for attending, and we'll keep you posted on future presentations. Thanks, and have a great rest of the week.